Hi everyone, my name is Carla Brackstone. I am a Partnerships Manager at Kheiron Medical Technologies, and I'm going to talk a little bit today about our AI tool, Mia, and being used in breast cancer screening and some of the broad safety considerations that come alongside that. So broadly what I'm going to cover today is just a bit of an introduction to us, to Kheiron, to who we are and what we're working on, specifically our product, Mia. And then just going to do a really sort of broad, high-level touch point on some of the initiatives and considerations that we work on that come under a sort of broad safety umbrella. So not specifically just clinical safety, but everything that we do that can come under that aspect. So to start with, who are Kheiron? So this is our team here. We are a small to medium UK AI startup. We were founded in 2016, so we're about 6 years old. We are focused on breast screening. And we are doing that through supporting, not replacing humans in workflows. And at the moment, our key focus is building sort of robust evidence, or generating robust evidence, and building clinical relationships across the sector as well. Our sort of company slogan over there, giving any woman anywhere a better fighting chance against breast cancer, is our sort of North Star, our goal. So why are we specifically focused in breast screening? So there are a number of challenges, and we recognise the challenges that exist in breast screening programmes across the UK, namely to do with workforce challenges. So it's a high-stress environment with high workloads. You see high levels of burnout in this area, and all of this can sort of impact on a participant experience in a screening programme, so that can lead to unnecessary recalls, which gives increased stress to patients, that sort of thing. And on top of that, there is a shortage of trained breast radiologists and radiographers in the UK as well, and we're expecting that gap to widen. So what we have done as a company is to develop an AI tool that solves some of these problems from a workforce perspective in breast screening. So our tool is called Mia. So it's mammography intelligent assessment, and it's essentially a suite of products. So it fits across the entire pathway, and I'll come to that in a second. But the goal of Mia is to empower radiologists to do their job and to free up their time, and also to improve breast screening programs itself as well. So I mentioned that Mia is a suite of products. So I'm going to broadly touch on it, but I'm going to focus on one specifically. So we have developed products that fit across the entire patient pathway for breast screening. So right from an initial sort of appointment scheduling, we have some tools that can help to prioritize appointment scheduling, through to a participant coming into the clinic, having a mammogram taken. We have some AI tools that can support in assessing image quality, through the reading process, and eventually through a diagnostic and quality control aspect as well. What I'm specifically going to focus on today, and is the focus of our AI award as well, is Mia as a reader. So this is where Mia is serving as an independent reader or concurrent reader at that point in the pathway, sort of after the mammogram has been taken. So Mia as an independent reader essentially provides a binary case-wise decision, so much in the same way that a radiologist will pick up a mammogram and make an assessment. They'll decide, is there anything suspicious in this image or this set of images that require me to call back this participant for further assessment? Mia essentially does the same kind of assessment, so it provides a binary recall or no recall suggestion for that case. And the way we sort of envisage this fitting into a breast screening pathway is shown here. So at the moment, a standard breast screening pathway is done through double reading. So every mammogram is read by two human readers, so two radiologists or radiographers. They will both provide an independent recall or no recall decision. If there's agreement between those two humans, that is the ultimate outcome. If there's any disagreement, then it'll go through an arbitration process, and this can vary site by site exactly what that looks like. Either it's a third independent person or a group of people who will make a final decision on this case, and then it flows out to that ultimate outcome. The way we picture Mia fitting in here is by essentially replacing one of those two human readers in the initial read. So every mammogram will be read by a human reader and will be read by Mia, and then the rest of the pathway essentially stays the same. So if there's agreement between the human and Mia, that is the ultimate output. If there's disagreement, then whatever arbitration process already exists at site will just continue, and a final decision will essentially be made. So just to touch on some of the work that we're doing and what my main focus in my role is. So we were one of the winners in the first round of the UK Government AI and Health and Care Awards, so what was the NHS AI Award. We were given this in sort of September, October 2020, and this is funding for us to work for up to 3 years, to work with up to 15 different sites to conduct various bits of research on deployments and evidence generation. So our main goals as part of the AI Award We are looking for a key part of the evidence generation, and this is with the ultimate goal of informing or changing national policies so that we can start to work towards AI being adopted in national screening programs. We're doing this with the support of independent evaluators. So one of the key parts of the AI Award is we have an external independent evaluator that helps us on that journey, so helps us design the types of evidence we're generating, as well as the ultimate analysis and publication of those results as well. We are working really closely with a lot of clinicians in this area in order to start building the trust of the use of AI, as well as getting their opinions on our product development and deployment methodologies. We have genuine patient and public involvement support. I'm going to come on to this a little bit later. That's a key thread of part of our AI Award. And another part that I'll come on to later as well is a key goal of our AI Award is working towards generalizability. And we're doing this through a number of different studies. So we're running a retrospective study, as well as starting to move into running prospective studies. But ultimately, our end goal is for the safe deployment of MIA into NHS breast screening programs. And just some pictures there of some of the teams we're working with. So the bottom left, that's our team in the North London breast screening program. We're also working with Newcastle and Gateshead in that picture as well. But we are spread across all of the UK in terms of the partners we're working with. So that's just a brief introduction to who we are and what we're doing in our products. So I'm just going to really generally touch on some of the initiatives that we are working on, or some of the considerations that we take into mind as part of our work that's probably of interest in the broad topic of safety. So the first of which I'll touch on is data protection. And there's a bit of a conversation in the last talk about this as well, but this is one of the sort of initial hurdles that we face when we start working with a trust. So the way that we do our work is that all of the data is pseudonymous or pseudonymized. Either if we're working retrospectively before we extract that data and work with it, or if we're working prospectively before it is moved to the cloud and handled or processed by MIA at all. We've worked really closely with some external data protection consultants. So this was just to help us sort of build all of this data protection positioning around all of this and some of the supporting documentation. And this has gone a really long way to help us to start to build the comfort and trust of NHS IG teams. That's been a real challenging part of the work that we're doing, of just the huge variance in understanding and appetite for this type of work. Some of our wider team as well are involved in some broader initiatives. So we've been involved in some workshops that the ICO have been running in terms of driving the agenda more broadly on information governance and AI. We also work under really sort of strict security policies. So although all of the data we're working with is pseudonymous, it's still subject to all of our security processes. And as part of this broad piece of work as well, we've also been looking at some of the appropriate consent models to be using as part of the research that we're doing, which is particularly more relevant as we move into prospective use as well. So the next part that goes slightly hand in hand with data protection, and I'm not going to go into detail on this, it's not my area of expertise, but is part of the regulatory and standards compliance work that we do. So I'll briefly touch on it. But so MIA is a medical device, it's software as a medical device. So it is a CE marked Class 2A medical device, which means that we're sort of compliant with all of the processes as part of that. We have the tech files and all of the submissions that we do as part of that process. We're compliant with a number of different ISO standards. So we have quality management systems, risk management systems, life cycle processes. As again, we're moving more into prospective use and active deployment, we're becoming more involved in the DCBO 129 aspects of this and working closely with our partners on the 160s. And the last point, I know we're going to hear a little bit more about this later today, but we're also aware of a lot more of the guidelines that are coming out and trying to factor this into the work that we're doing as well. So that sort of leads on to the deployment methodology, and I think this is where we sort of see the largest pillar, or the largest opportunity to ensure safe use of the product is in the way that we actually deploy the product into site. So we have a 6-step process that we use for deploying into sites, and this is all largely done before we even start impacting any level of patient care. So the 6 steps, we start with what we call the understand step. This is where we'll spend a lot of time with the site that we're working with. We'll spend a lot of time really understanding all of their clinical workflows, all of their clinical processes, what sort of technical environments we're moving into, what their objectives, what their pain points, all of that kind of thing, so that we can really scope out exactly how we're going to be helping them solve some of the issues that they're facing. The second step is what we call connect. So this is essentially the technical part of the deployment. So we'll be installing MIA into the trust systems. So we'll be connecting into the PACS in order to be able to receive images. We'll be connecting into the clinical information systems to be able to give outputs. And our engineers sort of go in and do that full end-to-end testing of that entire process. What we then do is the third step we're calling validate. This is where we will essentially be running Mia sort of silently in the background, not impacting any patient care, but we'll be essentially assessing Mia's performance on that local population. So it's an opportunity for us to work out if Mia is performing exactly as we would expect on that population we're looking at. And if it's not, we have an opportunity to obviously fine-tune that so we can do any kind of threshold moving or any kind of calibration on that local data. The fourth step then is train, and this is where we start to work really closely with the clinical and administrative teams in the breast screening program we're working with. So this is making sure that they really understand the product, so what Mia is, what it can do, more importantly, what it can't do, and exactly how they're going to work hand in hand with this tool and how it exactly impacts their day-to-day operations. The fifth process is what we call launch. So this is more of a change management piece, really. So this is where we're moving through all the various approvals that we need to in order to move live. So running through any kind of internal trust boards, making sure that wider communications are in place that this technology is about to be launched. And the sixth step then is when we eventually go live within a live clinical setting and start actually supporting the clinicians in their day-to-day work. And it's called monitor because obviously we're continuously monitoring any of the performance there. So we're looking at all of the key metrics as part of that, as part of the running of the tool in a live setting. So this is sort of the six steps that we work with. And as I say, this is designed intentionally to be able to support a safe deployment and to be able to support the adoption of this type of technology. One of the other really key pillars of our AI award that I referred to earlier is the PPI work, so the patient and public involvement work that we do. So we have a dedicated PPI advisory board, and this is used to support all of the knowledge and insight that we've used to be able to actually build the tool itself, so that for product development purposes, as well as for all the deployment methodologies that we've been using. We've also conducted some really extensive literature reviews and interviews in order to be able to really understand the attitudes and beliefs towards AI for the adoption in screening. And I know we saw the video earlier about some of those types of opinions. It helps us to understand the types of hurdles that we're going to be facing in this setting. As part of our AI award as well, we're collaborating with all the PPI leads at the trust we're working with, particularly as we're moving into prospective use. And this is with the goal to ensure that every type of opinion across all the populations we're working with are covered. And finally, any kind of information materials that we create, so any posters we put up in clinics, any leaflets we send out, any letters about any type of research that we are conducting, all goes through a co-designing process as part of our PPI advisory board. So this is just to ensure that any of the language and the information that we're using is appropriate and informative. One of the other key goals of the AI award I referred to is generalizability, which is a big word in terms of AI in healthcare, but essentially what our goal here is to work towards that slogan that I said at the beginning, so making sure that Mia can be used for any woman, anywhere. So we have previously run a large retrospective clinical trial. So this was across 7 different sites across 2 countries, so the UK and Hungary. And there are some stats in the top corner about the trial. So it was with over 180,000 women, 275,000 cases. And what we've used as part of that clinical trial are clinically relevant endpoints. So endpoints looking at things like recall rate and cancer detection rate, which are endpoints that screening clinicians or screening units will be used to seeing. As part of our AI award, we are looking to run another retrospective study, and this is specifically looking at spreading across the UK in terms of demographics and population. So this really helps us towards the goal of being able to understand how Mia can perform across various different demographics, across different ethnicities and things like that as well. So inclusivity and diversity is a really key point there as well. One of the other major factors here as well is about hardware. So we ensure that all the trusts that we're working with have a coverage of different types of hardware. So if we're using different mammography machines, for example, it can affect the way that the tool works. So we have ensured that we can stratify all of our performance against those different metrics as well. That's just a few more kind of key stats about the trial. I've already covered most of those. The other thing we can stratify by as well is the types of cancer, or the invasivity of the types of cancers that we're picking up there as well. But lastly, I'll just touch on some of the work, for the reason that I'm here, some of the work that we've been doing with the team here in York and NHS Digital. I know Sarah's already referred to a large part of this as well, but we've also been one of the case studies that's been involved in the project with the team at NHS Digital. So we've been working on the safety assurance framework for machine learning in the healthcare domain. So this is essentially taking the AMLAS framework that Sarah referred to and understanding exactly how that fits into a healthcare setting. As part of that, we've had some really cool kind of spin-out pieces of work as well that's come up. So we've been able to look at some of the human factors, the white paper again, which I think we're going to hear about later, but been able to look at that as a more kind of contextual review and using Mia and our situation as a specific case study for that, just to really understand how well the frameworks fit into a healthcare setting and how well a manufacturer like us can adapt to these different guidelines and frameworks that are coming up. And we also had the opportunity, again, to use Mia as a bit of a case study at a recent clinical risk management training that we held here in York. So that's kind of a bit of a summary of what we've been doing with the team here, and I will wrap up there. I'm very happy to take any questions.